I did have some questions though, because I think as a pharmacist, okay, and so I'm thinking of children who have problems like attention deficit syndrome or fetal alcohol syndrome is another one we experience in Manitoba.
Yes.
And consequently, these children are a real challenge.
Absolutely.
That's if they had normal parents, it would be a real challenge.
Absolutely.
And they don't have normal parents to begin with, or else they wouldn't have a fetal alcohol syndrome child.
That's right.
Let's say, or an attention deficit one, hyperactivity.
Absolutely.
So those are things that I see as challenges for you, and I don't know how you're going to handle those. Maybe I should give you a second to answer that question.
I would love to respond to that. You're absolutely right. There are some children that bring additional problems. This book is not meant as a magic pill that will solve all problems with children. Two things. There are some children who need the intervention of mental health professionals or, in some cases, help with their biochemistry. And we're not saying that by applying these principles that need will go away. However, the caretakers for those children have a tremendous need to be able to step back and to get centered themselves. And if they can learn a way to get heart-centered, and many of them are. I mean, I have seen people dealing, especially with these incredibly challenged children, and they're in their hearts, I'll tell you. But there are some who are not. And by learning how to shift their energy back into that heart space, and will allow them to feel the calm that comes from that, rather than being pulled into the drama that's going on with the child. And we actually do have a technique when you're in the middle of a drama with the child to actually step back from that and get back into that heart-centered energy. And that's incredibly helpful when you're dealing with especially difficult children. It's not going to solve the problem.
So would you call your philosophy a tough love philosophy?
Not at all. I wouldn't. No, because the tough love approach is a form of discipline. We're not saying that you should use the tough love or not use the tough love, but whatever technique or strategy you're using, to do it from your heart and from that centered energy, it will be more effective. Because if you're using tough love and you're coming from anger, you're out of control. As soon as that child can push your buttons and you get angry, you've just thrown your control away. You've jumped into the drama with the child, and where is that? Who's in charge now? Probably the child. But if your child is out of control and you can stay calm, you stay in control. So it's not a matter of what approach you're using, but it's a matter of how you are carrying it off. And you'll carry it off better if you're calm than if you're angry.
Thank you.